is Srishti Arora, and I'm working as a consultant radiologist at Star Imaging Diagnostics, Ludhiana. I've done my MD radiology from DMCH, and I have done my SRship in intervention radiology from DMC Ludhiana. Today I'm here to talk about a very important topic that patients present with in emergency department, that is small bowel obstruction. How radiology plays a very important role in the diagnosis of small bowel obstruction. I'll be discussing about the various imaging modalities that can diagnose small bowel obstruction and which should we go for first, which can help clinicians make a better diagnosis and to assist in therapeutic decisions, that is whether to go for conservative management or to go for immediate surgery. In this, radiology plays a very important role, as we all know. First, the preliminary investigation is X-ray. As we know that the patient comes to the emergency, the first investigation that we order is an abdominal X-ray. The patient presents with abdominal pain, nausea, vomiting, abdominal distension. X-ray is useful to help us to tell whether there is obstruction or not. Dilated small bowel loops can be picked up, but the diagnostic accuracy is very less. The major modality is CT, multi-detector CT. Ultrasound also has a very limited role. If the fluid-filled loops are there, then ultrasound plays an important role, but if the bowel loops are filled with gas, then ultrasound has no role in detecting small bowel obstruction. The major modality is multi-detector CT, CECT as we say, contrast enhanced CT. In this, oral contrast is not given because the patient is already in distress, the bowel loops are dilated, distended with fluid, and we are forcing him to drink more liquids, more oral contrast. So what is the purpose behind it? And the fluid retained in the bowel loops is sufficient for helping us to make the diagnosis. IV contrast is a must in CECT to help in diagnosing the small bowel obstruction. And it is very useful in detecting the extramural abnormalities in the abdomen and to determine the cause of obstruction, the transition point, which is the zone of transition between the dilated and non-dilated bowel loops. I will be discussing all this in my lecture. And CT also plays a very important role in detecting the complications of small bowel obstruction like bowel ischemia, perforation. Pneumoperitoneum can be detected on X-ray also, but bowel ischemia is detectable only on CT. Thank you.